A new report released last week details a rise in Idaho's maternal and infant mortality rates between 2019 and 2021. This comes after the Idaho Legislature declined to renew its Maternal Mortality Review Panel, which leaves Idaho as the only state without a committee that looks at the causes of postpartum death in new mothers. This week, Smith of Idaho Voices for Children joined me to discuss policy recommendations they hope will reverse that trend. Thanks so much for joining us this week. What does the latest report say about infant and maternal mortality rates?
Over the past few years, we've seen an alarming trend in maternal and infant health outcomes. We're seeing an 18% jump in infant mortality rates and 121.5% increase in maternal mortality rates, among other troubling trends such as low access to prenatal care for mothers in their first trimester and higher rates of low birth weight and preterm babies.
What year did this report examine?
This year's report looked at 2019 to 2021. Unfortunately, with the effects of COVID on data collection, many of our sources of looking at this data are from many different years. So we tried to really look at the years we saw the most comprehensive data.
And so, with 2021, the first thing that pops into my mind, as you said, is COVID, and we know that there were documented increases in substance abuse and use, including alcohol, and documented increase in mental health crises, and then of course the direct health impacts of a COVID infection on pregnant women and fetuses and infants. Was there any correlation or any link that the report found between the increase in deaths and COVID in 2021?
While we weren't able to point directly to COVID, we can make a few assumptions here and there because the main contributing factors that Idaho's Maternal Mortality Review Committee's latest report found was in maternal health trends and specifically in maternal deaths. The top contributing factor was a lack of knowledge around the significance of their health event and their lack of access to care and the financial resources they needed to receive treatment.
When you say that, do you mean like symptoms of an infection or an adverse symptom or after effect of having birth or giving birth?
The MMRC, Maternal Mortality Review Committee, said that the top links in maternal deaths were surrounding mental health conditions. So this could be postpartum depression or other mental health conditions and infections, yes.
And so when we say mental health conditions, we're also including, deaths by suicide in the causes of death there.
Correct. This is their pregnancy-related maternal mortality ratio.
How many of those deaths were preventable?
Unfortunately, in their latest report, they found that 88% of maternal deaths were preventable or treatable.
What's the difference between rural outcomes and the more metropolitan or urban areas of Idaho when it comes to those maternal mortality rates?
What we've seen in terms of the rural areas using Medicaid as their primary form of payment during delivery, we've seen a 30% of Idaho mothers you have Medicaid at the time of delivery. And what's really important here to explain is pregnancy is actually not a qualifying event for pregnant women. And what that means is if a woman doesn't have health insurance when they become pregnant, they are not eligible to just go and sign up for a health insurance plan because pregnancy is not considered a qualifying event, making them have to wait for an open enrollment period, which is why Medicaid becomes such an important piece of this conversation, because Medicaid doesn't have open enrollment periods. Anyone who is eligible for Medicaid can sign up at any time.
Is that a state policy or a federal policy?
For qualifying events, I think it's something that the state could explore, but I'm not sure what the federal implications would be.
You've touched on this a little bit, but policy recommendations to address this rising maternal mortality death rate. What are some of the things that your agency, your organization would like the legislature to explore?
Sure. You know, we understand there are tensions rising around Medicaid, but what this boils down to is Medicaid is the public health system that low-income women and children have access to receive health care. It's the system we have, and it's the system that we have opportunities to improve in. And truly, when we're looking at our recommendations, what we are really thrilled to be working with the legislature on during this upcoming session is a comprehensive maternal and infant health package, which includes raising income eligibility for pregnant women and children to access Medicaid and CHIP, extending postpartum coverage to a full year, because as it stands now in Idaho, it ends at 60 days after delivery. And of course, reinstating Idaho's Maternal Mortality Review Committee.
Let's start with the income eligibility. Why is that so important?
Right. So for raising income eligibility, Idaho is last in the nation in providing health coverage for pregnant women and children, meaning we have the lowest income eligibility criteria in the nation. And further, for pregnant women, it hasn't been updated in Idaho since 1990, and for children, it hasn't been updated since 2004. So Idaho Kids Covered, we believe it's time for change, and if we don't act now, these concerning trends will continue.
And in that time, wages have risen, but cost of living has also risen substantially since 2004.
Sure. And income eligibility is set by a percentage. So in Idaho, for pregnant women, it's 138% of the federal poverty line, which does get adjusted for inflation. But what that looks like in Idaho is for a pregnant woman, she has to make less than $34,000 a year to qualify.
When we're talking about postpartum care coverage extending a year after birth, what does that care look like for people who haven't had babies before?
Sure. So the government entity that reviews every maternal death in Idaho, the Maternal Mortality Review Committee, what they found in their latest and unfortunately last report is that about 56% of the maternal deaths happened 43 days after they gave birth. And typically in conditions such as postpartum depression, which we are above the national average currently, those effects can take hold later on than, immediately after birth. They happen later on, and same things with infections. And truly, when we are looking at expanding to a full year, we're able to capture women who may need access to care later on. And if we try to boil it down, for those who haven't been pregnant before, at 60 days, you are dealing with trying to raise your newborn baby and making sure they're going and getting their checkups and appointments. And frankly, your needs take a back seat. And so to try to get the health care you need in those 60 days is really difficult, especially when we consider the statewide provider shortages we're seeing in our state.
Let's touch on that a little bit, because I think a lot of the conversation in the last year and a half surrounding provider shortages has focused on Idaho's abortion trigger law that went into effect after Roe v. Wade was overturned in 2022. To be clear, this report looks at data from 2021 before that went into effect.
Correct. Yes.
And none of your policy recommendations have anything to do with that abortion law.
Correct.
Let's talk a little bit about that Maternal Mortality Review Panel. Idaho right now, after that review committee sunsetted in July, Idaho is now the only state without a review committee. The legislature was hesitant and ultimately did not renew that, and the committee was disbanded. Is this something that the private sector and hospitals could get together and do themselves without the legislature working on it?
Unfortunately, I don't see how the private sector could get involved, because this information, this data is protected, and it's under the Department of Health and Welfare. They hold this data. They were able to share that with the committee due to the legislature enabling this committee to do so. So without legislature's action to reinstate this committee, the private sector just wouldn't be able to get involved. But more so, we should all be asking ourselves, going forward, in looking at this report, seeing all of these alarming trends, how are we supposed to make sound policy solutions that meet the unique needs of Idahoans if we don't have Idaho-specific data anymore.
You mentioned trying to increase Medicaid coverage for pregnant women and making pregnancy a qualifying event to sign up for Medicaid. This legislature is very hesitant to do anything to expand existing Medicaid programs and is looking at reining a lot of those costs in. How do you sell this to lawmakers considering that hesitancy?
Sure. I'll say this. Every maternal and infant life in Idaho is precious and valuable. We have to do all that we can to ensure the health and safety of our mothers and children in our state. And if by raising income eligibility, by expanding postpartum coverage, we can ensure that more mothers and children have access to the life-saving care they need when they need it.
Have you started having those conversations with lawmakers already?
Absolutely, and we are very thrilled to be working with them during the upcoming session on what we know is a top priority for all Idahoans, the health and safety of Idaho moms and their babies.
How are those conversations going? Are you optimistic?
I'm optimistic. We're having really great conversations, and truly, I think we all know right now this is a top concern, and we want to ensure that moms and babies get the healthy start in life that they deserve.
All right, Ivy, thank you so much for joining us.
Thank you.
For more, including a link to the report on maternal and infant health and mortality in Idaho, visit idahoreports.org.